enjoyed lunch and little chats together. We have slightly overrun, we always do every year with the agenda, but we've allowed for that within our timings as well. My only advice to you is the Tottenham are playing at home today because they don't have a ground. So they're playing at Wembley today. So we should be out 5 o'clock.
Well, the whistle will blow about just about 45 on.
Yeah. So just to give you a pre-warning, get out as soon as you can. She's going to be stuck with a football fan. Okay, I'm just going to have a quick chat. A lot of people have asked me about doing a children's event. And over time, I've just been so busy with different things. And luckily, we've had an opportunity that's been made available to us. So what we're hoping to organise is an event next year for children that have an Olliers or Maffucci diagnosis to come to an event with their family and their siblings so they can meet other children and they can socialise together. We are looking at holding the event at somewhere called the Snow Dome, which is in Tamworth. It's in the centre of England. Basically, it's a venue that's indoors and it's got lots of different activities under one roof. It's got ice skating, it's got a snow playground, it's got tobogganing, it's got a climbing wall, and also it goes quite well with the snowflake theme, coincidentally. It will be available for any child aged 2 years plus, because that's what the activities are for. It's all under one roof. They're 30-minute activities, so we'd look hopefully for children to take part in 2 activities, have a little snack, little break, go back to the other activity, come back to a party room where there'll be food and a disco, and give them chance to do some activities and socialise with one another. It is a UK central location with excellent transport links because it is in the centre of the UK. Lots of accommodation in the area, and we are looking for it to be fully funded again. So you won't have to pay for anything to attend, just your transport and accommodation. Everything else will be sorted for you. As I said, it'll be for the children, their parents and their siblings, hoping to do it in school holidays, so we'll just have to work out when everybody's school holidays are because they're all different now, and just making it a fun and social event. So here is where Tamworth is. I can't use that button. That one. Oh, look at that. So it's up here in the middle. So it's just south of Birmingham. North or south of Birmingham? Is it north of Birmingham? North of Birmingham. So it's really, really easy to get to. So here are some of the activities that we've got. We've got tubing, tobogganing, a snow play area. And like I say, parents can get involved in these activities as well. Some of them do require an adult to do the activities. I won't go into that in too much detail because I'll send out flyers and things for it. We've got swimming there, there's ice skating and also a climbing wall. These activities are accessible for children who are maybe in a wheelchair or require support. There's a disabled organisation that works with the Snow Dome that is able to facilitate those children. Wheelchairs can go on the ice skating rink, which I think is amazing. So there's lots, it really is really open. The thing is, I want to know from families and things here today, and what we're going to do is we'll put one of these boards out in the lobby, or you can put on your evaluation forms at the end of the session. Just let us know any issues that you think may come up with this and with your child and things that we may need to consider. We are looking to provide hats and like snoods for you, also looking at gloves. You just need to make sure that your kids kitted out so they're nice and warm, okay? So yeah, I just want to know what your thoughts are. And then the other thing is looking at like support. So it could be like funding and sponsorship. Because we want to, it's a kids event, we want to make sure that it's fun. So like give them goodie bags and things like that and make sure that it's a good opportunity for them to socialise with individuals. So that's me done. I just wanted to do a quick update there. What I'm going to do now is I'm going to pass you over to Tor. Tor has been coming to the conference for, oh my goodness, how many years now?
I only missed the first one.
I think it was the first, oh, see, you didn't make the numbers up, Tor. So Tor has been coming and she's absolutely fantastic. She's been a great support to me as a parent with the condition, to see it from the perspective of somebody that's been living with the condition. The other thing with Tor is, I think she's helped out a lot of families in here. We're going to talk about, oh, I get upset now. And the thing is with these personal stories is they are so personal, and I think we've had them for the past 3 years here at the conference, where an individual takes time to come up and actually share their experiences, and I think it really opens your eyes, and you can relate to some parts of it, maybe not so everything, but you can see different perspectives of how people are living with it. So, Tor, would you like to come up? One thing I do want to say is this afternoon we've got more guest speakers coming up. A lot of them, because we do have some children in the room, there are topics and discussions that may be coming up that you might not want your child to hear. It's totally up to you, but it's just letting you know that they may come up now.
Hi, well, as Charlotte just said, my name's Tor. I just firstly want to start by saying that when I agreed to share my story today, I didn't really anticipate how difficult it would be. You have to excuse me, I'm feeling really nervous. I've never done anything like this before. And also I apologise if I get quite emotional, which I am already, to Charlotte. If anyone has any questions or anything you want to ask me, please feel free to do so, or approach me at the end or whatever. I have Maffucci syndrome, although I was firstly diagnosed with Ollie's disease at 18 months old. My mum and dad took me to the doctors after my auntie raised concerns that my left leg was slightly bowed, and from there I was referred to the Royal Orthopaedic Hospital in Birmingham, where I was diagnosed, and I've been a patient there ever since. I know some of you are parents of children with Ollie's or Maffucci, so I'm sure you can sympathise with what a shock it is when you're told your child has such a rare condition. Back then, there was no internet or much information available about these conditions, so my parents had to put a lot of trust into the consultants who treated me over the years. I mean, I'm 38 now, so it was a long time ago. The whole of my left side is affected, my right side is completely normal. But it was only as I grew older that the symptoms became more obvious, thus becoming more problematic. I had my first operation when I was just 3 years old and spent my 4th birthday in hospital. Following on from that, I continued to have many surgeries on my leg, including removal of enchondromas and 2 leg lengthenings. I had the first leg lengthening when I was 9 and then again when I was 14. I think they had to lengthen it so much, they discussed with my parents and me whether we would be prepared to having my femur and tibia lengthened at the same time. So I had a fixator there and there. It would have meant that I only had to have 2 operations instead of 4, as both bones could be lengthened together. Obviously this was a winner in my eyes, so it went ahead and all went well. But they estimated I'd be slightly taller than I am, so now my right leg is slightly longer. No, my left leg is slightly longer than my right. I had many operations growing up. I don't remember what most of them were for, but my mum and dad just had to hope that the surgeries would benefit me in the future. By the time I was 17, the fingers on my left hand had many enchondromas, and my little finger was getting bigger quite quickly. It became red and painful. They got that big, the skin was stretching, and it caused a deformity of my ring finger. I don't know if you can see, I haven't got my little finger anymore. My hand consultant at the time was concerned that it had gone under malignant change, so I was admitted to have it amputated. The biopsy result showed a grade 1 chondrosarcoma. This was the first time I'd been made aware that they could become malignant. Following on from this, they did further investigations and they confirmed I had Maffucci's rather than Ollie's. Since then, I have had many more operations, one of which was the amputation of 4 toes. Again, the biopsy showed grade 1 chondrosarcoma. Excuse me. My most recent surgery was a full scapulectomy. following on from a severe amount of pain in my shoulder. The biopsy confirmed a grade 2 chondrosarcoma. I am seen every 3 to 6 months in the oncology clinic and have imaging if there are any concerns, but I have been having regular chest x-rays since the scapulectomy. I also have an enchondroma at the base of my skull, also on the left side, which I have a CT scan for every 2 years. Throughout my childhood years, apart from spending a lot of time in hospital, I lived a pretty normal and happy life. I used to love riding my bike, going on my roller skates, climbing trees and running around, although my run did have a bit of a style of its own. I loved PE lessons, but I wasn't supposed to play contact sports. I always wanted to join in so my teachers would change the rules so I could play. And I remember going to the park with my dad after my leg lengthening. I was still in plaster after having the fixators removed, but I really wanted to swing on the monkey bars. God knows how I got up there, but I still remember my dad's face, full of shock, worry and panic. I never wanted it to stop me doing anything I enjoyed. I was home tutored a few times after some of the bigger operations, and if I was in hospital a long time, a teacher would come around the ward. I really enjoyed this as it would get very boring, being stuck in a hospital bed all day long. The older I got, the harder I found it being away from school and all of my friends. It wasn't any of my friends' faults. Life just carried on in school without me. But whenever I went back, I felt like I didn't belong anywhere. Even with home tutoring, I missed so much school and always felt like I had to work harder to catch up. Things were becoming more difficult for me to deal with. Up until I went to high school, all of my friends had grown up with me and accepted me the way I was. But things changed. People who didn't know me and who just saw that I was different would call me names or just stare at me. I'd hear them say, "Ugh, don't go near her or you might catch it." No one ever bothered to ask what it was, but I wish they had, because things might have been different. By the time I was 15, I loathed school and had become very depressed. Growing and becoming a teenager is hard for anyone, but having to deal with a rare condition and the effects it had on my life already was tough. I wasn't coping well. I then lost my granddad, who I was very close to, and I became very insular. I distanced myself from my friends and my family, and I really felt like I was losing my mind. I couldn't cope with all the emotions that were going on in my head. I began to hate myself, the way I looked, the way I acted. I was so angry with the world. I questioned, why me? I must have done something terrible for me to be feeling like this. I was so angry with myself that I was feeling and behaving in this way. I started to self-harm. I was missing more and more school. I didn't want to get out of bed in the mornings. At only 16, I'd literally given up on my life. My parents took me to the doctors and they prescribed antidepressants and put me on a waiting list to see a counsellor. Initially, it didn't help. I struggled to share my deepest feelings. I hadn't ever really talked much about how it all made me feel. I just got on with it. I saw a counsellor for about 6 weeks, and during that time, my emotions were all over the place. Talking about personal feelings to a stranger wasn't easy, and 6 weeks wasn't really enough. Things got so bad that I really didn't want to live my life anymore, and just wanted it to end. I had an amazing family, a few good friends, and I was generally healthy. I look back at my former self and can't quite believe it was me. I feel ashamed and saddened for putting my family through that, but I just felt so out of control. Anyway, I managed to scrape through my GCSEs and pass most of them, which was a miracle. I was relieved my school days were over. I had always wanted to be a vet, so I began an animal course at college. I quite enjoyed it, but I still felt like I had no purpose in my life. Then I had the biggest shock of my life. I found out I was expecting a baby. There's my baby. Everyone was so worried for me. I was young and still dealing with my depression, but for the first time in a very long time, I was truly happy. I had a little person to take care of now. I had responsibilities as a mother. I had someone who needed me, someone to live for. Unfortunately, it meant I had to give up my college course and my dream of being a vet. The pregnancy all went well, but I had to have a C-section because I have enchondromas on my pelvis. Life was good. I put all my energy, time and love into my daughter and my family, and seeing her happy and laughing was the best feeling in the world. My daughter is now 20 and is at university, but she's here with me today along with my sister and my stepdad. I also have an 11-year-old son at home. I cannot express how grateful I am to have been given my precious children, or how thankful I am to them both for keeping me going all these years. I still get low at times. Long-term chronic pain is exhausting, and some days it's a real struggle. But I look at my beautiful children, and they are what keep me going. I trained to be a teaching assistant when my daughter started school, and I loved it. After my training, I worked one-to-one with a pupil for 7 years, and then as a general TA for 3. Sadly, due to high pain levels and needing further surgery, about 4 years ago, I had to give up my job. Work were very supportive and tried cutting down my hours, but I was struggling to cope physically and had become a single parent to 2 children. I found this at a really difficult time because the condition took something I loved away from me. Not long after that, I became quite poorly and was suffering with pain around my left ribs, and it was painful to breathe. I was admitted to hospital and given strong antibiotics. They were pretty useless at the hospital because they didn't know anything about the condition. I'm sure you can sympathise with that. I discharged myself and went to my own hospital. I was then referred to the QE, where they found a string of hemangiomas under my ribs. They also found that I had some on my liver and spleen. I had about 7 successfully removed from under my ribs. As I have got older, I have suffered more with the hemangiomas, and considering they are generally so small, they are extremely painful. I've also had some removed from my ankle, foot and leg. The biggest cause of pain for me is my knee, hip and ankle, and has been for many years. And even when I was in my teens, they said I would eventually need a knee replacement. Because of the extent to which the condition affects my leg, this would be a very complicated surgery. Over the years, my consultants have liaised with surgeons across the world to come up with the best plan for when the time comes. Unfortunately, there would be huge risks involved and could possibly result in amputation. It could also become more complicated if I have any chondrosarcomas appear in my leg. Because of these risks, I have just tried to deal with the pain the only way I knew how, with high levels of pain relief and just living my life the best I can. I try to enjoy the things I can do and focus on the positives, of which there are many. Since my scapulectomy, I have struggled even more with everyday things. I've had to learn to do a lot of things one-handed. Somehow, I've managed to adapt to most things. As there is no scapula for the muscles to attach to, I cannot lift my arm up very high, independently. I have had many hydrotherapy sessions, and this will need to be ongoing, along with land exercises. But I will never be able to lift my arm above my head and wave like that. At times, I still have pain in my shoulder, which, added to my other areas of pain, is exhausting, not just physically, but mentally and emotionally. Earlier this year, I broke down at a checkup with my consultant. It was all getting too much, even with higher doses of medication. But he suggested I try another method, mindfulness meditation. I have always been willing to try anything, so he referred me to Carol Hughes, who you'll be hearing from next. I have had 6 sessions with Carol so far, and she has been amazing. From having these sessions, I have realised that I've never truly accepted or faced the condition head on. I've always fought against it, not wanting to let it beat me or take over my life. Carol has taught me to embrace it, to treat it with love and compassion. Something I've never been able to do before now. I've learned that our minds work in a certain way to try and protect us, but often with long-term chronic pain that isn't always very effective or helpful to us. By changing my mindset and being aware of this has helped me more than anything I've ever tried before. Over time, this should also help reduce my pain levels. For my entire life, the focus has been based around the physical aspects of the condition. No one ever really talked about how it affected me mentally or emotionally. And I guess when I was really little, it wasn't really an issue. I strongly feel that it is just as important, if not more so, than the physical side, and everyone dealing with this condition should be made aware that there is support out there if and when you need it. I really wish I had been offered this kind of support when I was younger. Maybe then I wouldn't have felt the way I did throughout my teenage years, or at least been able to deal with those feelings better. I would just say to you all, keep talking and keep sharing, because bottling it up really doesn't help. You'll be relieved to know I'm nearly done. But before I go, I would just like to take this opportunity to thank a few people. My wonderful family for always being there for me with their love and support. To Carol for guiding me through the mindfulness programme. She's been incredible. And lastly, to the lovely Charlotte. She's not only organised this event for us, which I always gain so much from, but she's also been supporting me in preparation for today. I am so grateful that we all have this opportunity to share our experiences, and together we may find the answers. I have hope.